Good day, this is Andy speaking, welcoming you to watch a 2025 update to the Expert Field Medical Badge Testing Instructional Videos. This video depicts the Tactical Casualty Combat Care Task 2, Airway Management. This task is usually performed multiple times during a 105-minute continuous lane. However, because specific wound patterns and locations are selected by hosting units, the task in this video is shown in a standalone format. The video was recorded in September 2025 and tasks are performed to the June 2024 EFMB standards recorded in MEDCoE Pamphlet 350-10. A special thanks to lane graders for demonstrating this task and filming the videos. These videos were filmed to serve as candidate study guides during local training and testing and are not affiliated with EFMB Test Control Office.
Alright, start Airway. I'm going to down my PSI. Alright, PSI is on. I'm going to go ahead and assess my airway using a head tilt chin lift. Look, listening and feeling. Alright, this casualty is unconscious, so I'm going to go ahead and give this guy an MPA. Head is in the supine position. Checking for nasal obstructions.
Nasal passages are not obstructed.
Alright, perfect. We go ahead and do an MPA on this guy. Perfect. I go ahead, open my MPA. I'm going to size it from the bottom of the nose, bottom of the ear to the tip of the nose. Open my lube. I've got my MPA. And insert my MPA. MPA is inserted. Go ahead and secure it. MPA is secured. We go ahead, reassess.
Airway is patent.
Airway's patent. This guy's good. Move on to my next casualty. Alright, going on to my next patient. I have my BSI. I'm going to go ahead, assess the airway. Go down using the head tilt chin lift. Look, listen, and feel. Go ahead, put the head in the supine position. I'm going to go ahead and check for nasal obstructions.
Nasal passages are obstructed.
My nasal passages are obstructed. I'm going to go ahead and check airway for patency.
Airway is not patent.
Airway is not patent. I have to do a cric on this guy. Okay. I have my cric. I'm going to go ahead and prepare all my equipment. Alright, all my equipment. Go ahead and take my sheath off. Inflate my bubble with 10 mils of air. Looking for the balloon, looking for the pilot bulb. Equipment is good. Go ahead, set this down. Okay, I'm going to identify the cricothyroid membrane. My hill, valley, hill. I'm going to go ahead, cleanse my site with an alcohol prep. Site is clean. I'm going to go ahead and stabilize the larynx with my non-dominant hand. Reconfirm my index finger. Take my scalpel. I'm going to make a 1-inch vertical incision. Reconfirm my landmark with my index finger. Turn my scalpel horizontally. Poke through the membrane with a 1/2-inch incision. Remove. Close my scalpel. go take my trachea hook, insert, and elevate the cricoid cartilage. I'll then take my tube, insert it through the membrane down towards the lungs, while very carefully removing my trach hook. I'll then inflate my bubble with 10 mils of air, ensuring that my pilot bulb is inflated. Once that's done, I'm going to go ahead and confirm my placement using a BVM and stethoscope. Alright, go ahead, auscultate the apexes of the right and left lung.
You hear breath sounds in all lung fields.
Right, perfect. I have breath sounds in all lung fields. I'm now going to check my patient's pulse ox and respirations. Pulse ox is on there. I'm going to check for spontaneous respirations for 10 seconds. 2, 3, 4, 5, 6, 7, 8, 9, 10.
In 10 seconds, you observe 3 respirations. The patient has a pulse oximeter reading of 95%.
All right, perfect. This casualty does not need any additional ventilations. I'm going to go ahead and secure my cric tube. Secured. I'm going to go ahead, take my gauze, wrap it around the tube. I'll then secure my gauze with tape. Where I put my tape. Going from skin, gauze, skin. Alright, my cric is confirmed. I'm going to go ahead to my next casualty.